Good afternoon, Bickner Wilson. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Good morning, Mihiraa. I'm Bickner Wilson, a nurse here at the pre-surgery ward. I am here today for your preoperative assessment for septoplasty, and I'm here to discuss the procedure, what to expect during recovery, and any potential risks. Do you have any initial questions or concerns you'd like to bring up right away?
Good morning, Nurse Wilson. Yes, I am a bit nervous, to be honest. I've never had surgery before, and I'm not entirely sure what septoplasty entails. I just want to breathe better, but I'm worried about the whole process.
It's completely understandable to feel nervous, Mihiraa, especially when facing surgery for the first time. We're here to make sure you feel as comfortable and informed as possible. So my goal today is to give you a clear picture of what the procedure involves and what you can expect afterward. Septoplasty is a very common procedure, and it's performed to correct a deviated nasal septum. Essentially, it's a day surgery, meaning you'll likely go home the same day. The main aim is to improve your breathing, which can also lead to fewer nosebleeds and often a significant improvement in snoring and overall sleep quality. Does that make a bit more sense regarding the purpose of the surgery?
Yes, it does. I'm really hoping it helps with my breathing and the constant stuffiness. So, how long does the surgery actually take, and what exactly do they do?
That's a great question, Mihiraa. The procedure itself typically takes between 30 to 90 minutes. You'll be under general anesthesia, meaning you'll be completely asleep and won't feel anything during the surgery. The surgeon will make incisions inside your nose, so there won't be any visible scars externally. They will then reshape or remove any cartilage and bone that is causing the deviation in your septum. Often, a soft internal splint is placed inside the nose for support after the surgery, which is usually removed after a few days. Does knowing the specifics of the procedure bring up any other concerns or questions for you?
Well, the idea of internal splints sounds a bit uncomfortable, but I suppose it's for my own good. What about after the surgery? What are the chances of something going wrong, or what kind of side effects should I be prepared for?
It's natural to think about the potential risks, and I appreciate you asking. While septoplasty is generally very safe, there are some potential temporary side effects you should be aware of. Mihiraa, you might experience some temporary swelling and bruising around your nose and under your eyes for a few days. And it's also common to have some stuffiness or blockage in your nose for a few weeks as it heals. Minor bleeding and discharge are also normal in the initial post-operative period. In terms of post-operative care, we'll recommend pain medication to manage any discomfort, and you'll be advised to use nasal saline rinses to keep your nose clear and moist. When you're sleeping, it's helpful to keep your head elevated to minimize swelling. It's really important to avoid strenuous activity and heavy lifting for about 2 to 3 weeks after the surgery, and you should also avoid blowing your nose forcefully during that time. Does that information help you understand the recovery period better?
Yes, it does. It sounds like there's a fair bit to remember after the surgery, but it's good to know what to expect. So, how successful is this surgery usually? Is it a common procedure, as you said?
Absolutely, Mihiraa. Septoplasty is indeed a very common procedure, and I want to reassure you that it's generally considered very safe with a high success rate in improving breathing and related symptoms. Many people undergo this surgery each year with excellent outcomes. We'll be here to support you every step of the way, both before and after the procedure. Do you have any other questions or concerns that are on your mind at this moment?
I think you've covered a lot, Nurse Wilson. I feel a bit more at ease now. Thank you for explaining everything so clearly.
You're very welcome, Mihiraa. I'm glad I could help ease some of your concerns. Now that we've discussed the procedure, recovery, and potential risks, are you comfortable and ready for us to proceed with your preoperative assessment?
Sure, let's start.